Thank you. England is dropping almost all of its COVID restrictions on July the 19th, including the requirement to wear masks indoors, including shops and on public transport, at a time when cases are shooting up, with 100,000 daily cases forecast within weeks. What does the panel think of this decision? Thank you.
So thanks for the question. I can start and others may want to come in. So as you know, we're tracking this virus circulation all over the world, and we're seeing sharp increases in cases in far too many countries right now around the world, countries that are in all regions, all WHO regions around the world. Our recommendations remain the same of taking a comprehensive approach. Having said that, this comprehensive approach includes good surveillance, robust surveillance, active testing, and testing that gets results back quickly so that appropriate care can be given in isolation for infected individuals, so that contact tracing can take place, so that we prevent the onward spread. It means ensuring that our health workers are protected, are trained, are working and operating in a safe environment, having the supplies that we need to care for individuals and carry out all of these necessary actions to prevent infections, to prevent the spread, to save lives, and to get our economies back on track. And so we continue to recommend a comprehensive approach to suppressing transmission. Having said that, the guidance and the policies that we lay out are up to the governments to set those policies, to enact them. What we recommend are agile, adaptive approaches that are based on the local situation, taking into account the intensity of transmission, and if trends are increasing, if trends are decreasing, and looking at the intensity and the level of interventions that are needed in place. This includes individual level measures. It includes making sure that communities are well informed to know what they need to do in the areas that they live in. And so our recommendations remain the same. Our goal is to suppress transmission, is to save lives. And so we need those policies in place in all countries to be able to carry those out. And we need people supported in being able to carry out those levels of action.
And I think it's also a moment for extreme caution for countries right now. It's been good to see the drop-off in hospitalizations and deaths in many countries that are achieving high vaccination levels. I wish we could achieve that in all countries with increasing vaccination levels for the most vulnerable. But that's not to say that that's not a good thing in the countries that it's been achieved. But some of those, what we are seeing though, even in Europe, all regions of WHO have increasing cases in this last week. There's been a 33% increase in cases in the European region in the last week. So this is not a flat curve. This is an increasing curve. Making assumptions that transmission will not increase because we're opening up because of vaccine is a false assumption. Transmission will increase when you open up because, number one, we don't have vaccines in everybody, and number two, the vaccine coverage rates are lower, and we're not still sure to what extent vaccination protects against the ability to be infected or have onward transmission. This means with increased transmission in the community, we then put our most vulnerable at risk again. And there are many countries that have not achieved levels of vaccination amongst the most vulnerable. They're older and people with underlying conditions, or younger people with underlying conditions even, that would make lifting of all public health and social measures prudent at this time. Each country has to make its own decision. We're not here to be a nanny state to countries. But simple, straightforward, individual and personal measures that reduce the risk of you becoming transmitting virus or being exposed, like mask wearing, are very simple, they're very effective, and it's all about your own personal risk management. It's about preventing being exposed to the virus and preventing you exposing others to the virus. It's about proximity, how close you are to other people. It's about density, how many people are with you in the area you're in. Is it inside? It's about duration, how long am I spending in that environment? So you would imagine that underground transport, for example, as the example you gave, is potentially prolonged contact with many individuals in an enclosed indoor space. Individuals need to make their own decisions. People are smart, people have common sense, although some people say common sense is not that common. It's very important now that individuals themselves look to what's happening around them. Maria has said this many times here in the past. Look around in your community. Know the local numbers. If the virus is present in your community and transmitting, and you're a vulnerable person and you're not vaccinated, then you are potentially going to be exposed. So the idea that everyone is protected and it's kumbaya and everything goes back to normal, I think right now is a very dangerous assumption anywhere in the world, and it's still a dangerous assumption in the European environment. There are a lot of gains have been won over the last number of months. Many countries have suffered. Even the high vaccination countries have suffered. Their health systems have suffered. We need to think about what we truly value. Do we value going back to school in September? Do we value our universities going back online? Do we value our workplaces? And can we then continue to maintain key behaviours that reduce risk of transmission? Key public health measures that reduce the risk of transmission without disrupting normal life to the extent to which we've had that disruption over the last year and a half. So I would say, and I'm not going to comment on specific circumstances, but I would ask governments, we would ask governments, to be really careful at this moment, not to lose the gains you've made, to open up very carefully. We've seen over the last 6 months, case after case, country after country, in which there was a lot of increase in social mixing without adequate vaccine coverage, and we've seen wave after wave of cases. I would hope that in the European environment we won't see a return to the overwhelmed hospitals and the exhausted health workers. But that's not a given. This virus is evolving, this virus is changing, and we need to be very, very careful at this moment so that the gains that have been hard won by the behaviours and action of our population are sustained, and that we gain the benefit collectively of all of that effort. So individual behaviour and government support to that behaviour, extremely important, and I would urge extreme caution in the complete lifting of public health and social measures at this time, because there are consequences for that.